fortunate to have arrived on time from Scranton on a small plane that got fogged in 2 weeks ago, almost 2 weeks ago in Lock Haven. We were an hour late. So I still owe the people of Lock Haven an hour. I'm not sure how I'm going to be able to repay that, but I'm grateful that we were able to get here on such a beautiful day, and I'm grateful that so many people are here to discuss an issue which affects all of us, no matter who we are. Some 300 million Americans, if you're rich, middle income, or poor, healthcare affects you in one way or another. If you're very old or very young, or if you're in the middle, healthcare affects you. No matter who you are, what race, what creed, it is that important to our country. And contrary to what we're reading in some of the analyses that are done of this debate, people know a lot about this issue, an awful lot about this issue. People in this audience, in your own way, maybe not on every subject, it may not be so of every part of the legislation, but you're pretty good experts in what we're talking about here. So all this talk about this being too complicated for people, I don't buy. People deal with healthcare every day. You know exactly what it's like to deal with an insurance company. You know exactly what it's like to be in the hospital or have someone you love in the hospital. You know exactly what it is to have someone in your house who's sick or suffers from an incurable disease. We all know that. We're all experts at that. We're Americans. We've dealt with this issue for decade after decade. And I believe this fall is the time when we can finally confront it. Not push it off for next year, because there will be no next year, unfortunately, the way things are going. Pushing it off now means not dealing with it for years and years. The last time we had a full debate about this issue, even apart from the, thank God, the good success we had with children's health insurance, the last time we had a real debate about this issue was the 1990s. And prior to that was a lot of years before that. So I believe we can continue to have constructive discussions about this in a way that Americans do that. It doesn't mean that people aren't going to raise their voice once in a while, or express disagreement, or have vigorous debate. That's part of our system, and we shouldn't discourage that. But I think we can do it in a civil way, and most people have done that, and we're grateful. I wanted to commend everyone for being here. We'll try to do the preliminary part as fast as we can, because we want to get to questions. But I do want to commend also in particular Mayor Sinon, who's here. Mayor, thank you for being here with us today, and all the work that you do. Being mayor of any town at any time, anywhere, is about as tough a job as you can get. And we're grateful that you spend the time here with all of the things that you have to deal with, taking the time to be with us today. State Representative Flo Fabrizio is here as well. Thank you, Flo. Pat Harkins is here. Thank you. And Pat Capabianca, a man I've known for too many years. We're fathers of daughters. He's given me pretty good advice. But my wife, Therese, does most of the heavy lifting, thank God. So whatever the successes are attributable to Therese, my wife. I wanted to not spend a long time, but to mention and probably refer to later a person who fought very hard for this issue over many years, Senator Ted Kennedy, who passed away. Thank you for him, and thank you for his work. I think one thing that happens when someone of that prominence dies is often, not in every case, but often, we learn a lot more about their life. And I think even people that were in a different place than he was, politically or ideologically, or didn't like him for one reason or another, or disagreed with him, got to know the person and the legislator, as opposed to the icon or the public figure. And thank God they did, because you can say an awful lot about a person based upon their work. All the legislation he passed. If you just based his life upon legislation, you could say he's probably the greatest, the most effective senator of the last century. But there's more to that than more to a person than that. And I was especially moved by and impressed by, but not surprised by, what his family said about him, his extended family, but also especially his son. He told that poignant, emotional story that we can all identify with about helping him go up that hill in the snow and the ice when his leg had been amputated. So we're thinking about him today, helped mostly in that way, as a father and a member of a family, but also as someone who worked very hard on this issue. And one of the reasons that I'm going to concentrate, not exclusively, but concentrate on the Health Education Labor Pensions Committee that I'm a member of, and the bill we got out of our committee. It's the only bill out of the committee in the Senate. Finance Committee is still working on their bill, and I know they're working hard, but I'm proud of the fact that our bill was done in July. We had 60 hours of hearings. We accepted 160 Republican amendments, some of them very technical and maybe shouldn't be counted in some kind of total, but that's a lot of amendments. And it was a civil process, a lot of debate, a lot of disagreement, some raised voices, but it was a very civil discussion. We worked through June and July. In addition to the 60 hours, we had 20 or 25 hours by my count where we were walking through the bill within our caucus, the Democratic caucus, but also then we invited in the Republicans and tried to walk through, in summary form, major provisions. Some of that involved debate and discussion as well. So we worked very hard on it. And unfortunately, the way things happen is the day our bill was voted out of committee, the House bill was announced, and all the attention went on the bill in the House. And I know that Congresswoman Kathy Dahlkemper and others have walked through provisions of that bill. I'm going to spend time walking through the Senate bill, not in great detail, but also to refer questions back to that. If there's a question that deals with the House bill as a philosophy, or a philosophy, a better word to say is probably political or policy discussion, I certainly want to engage in that, because there are some similarities but some significant differences. If there are provisions in the upcoming Senate Finance Committee bill that will be voted on in September, and there are concepts that we want to talk about, I'll do my best, but everything I say will be prediction or anticipation of what the Finance Committee will do. So I cannot guarantee what will happen. So I wanted to give you that background. What we're trying to do basically, I believe, in our bill, but in the overall effort, whatever bill comes before the President, I hope we get to that by sometime in October. We want to reduce costs. Maybe we can go to the next frame here, and we'll go through these points a little later. But I'll talk about the overall framework of it. But the first thing that I want to do is to, first of all, thank the library, and in particular those who have taken the time to prepare for and to attend the H.O. Hurt auditorium for this event. I want to thank Margaret Stewart, who got us started today, and her staff who were here with us, and everyone connected to the organizing of this event.